Good morning, everyone. I'll be swift. I suppose, first of all, why am I up here? Why are we doing what we're doing? What started us out 7-8 years ago to go along and get doctor service operating in West Cork, first and most, it came from a personal experience. A very good friend of mine, his 6-year-old daughter was in a very difficult situation, to say the least, and unfortunately, due to a time issue, she passed away, and that destroyed both his life and his wife's life. And I suppose from another personal experience, it kind of was very opening to the challenges that are faced in Ireland today. So when we started out in the beginning, we went along and we had a great vision of setting up to solve this problem, because time was a big issue, getting medical care into rural areas. So in parts where I come from in West Cork, West Castletownbere, some of the peninsulas, you're talking well over an hour to get in, even in today's roads, to get to our centre of excellence, which is Cork University Hospital. And the biggest thing that we find with it is that timing is key in all this. So our vision initially, we had a great thing. We said, hey, let's get a group of people together. Let's get an air ambulance. That'll solve it all. That's really great. So yeah, we got a little bit of data together, and we got the facts and figures around associated with a heli service and the cost as well. So it was impractical for a start, because it's all well to have a mode of transport, but it's having the key personnel within that system was what we were looking for. So first and foremost, we said, look, the next best thing is that what we wanted to try and do is, if we can't get them there fast, let's try and get a bit of the emergency department to the side of the road, to the farmhouse, to the school, whatever. That's what we were looking for. So in fairness, when we signed up, we got some great volunteers together within the community, and first and foremost, we were very lucky. We had a doctor, Jason Van de Velde, who was one of the first to come on board with us. And Jason, his story over the last number of years, his work has been sterling. But the motivation, the success that we had with this was, we were blown away by it within that community. So I'll just give you a little bit about the Rotary. So what we basically did is, within the community, we got a community group together. We got a vehicle for Dr. Jason at that time, and we kitted him out with it. So basically, we said our model day one, we said we make it cost neutral. So we got all the specialist equipment that he would need, stuff that he probably only get in the emergency department, to allow him to operate within his geographical area. And in fairness, we were feeling our way for a long period of time. So what was our role in it? Our role was to kind of go out and fundraise and raise money for this event within the community. And in fairness, at the beginning, it was hard, because people didn't know what's all this about. Do you know what I'm saying? They couldn't distinguish between this and an after-hours doctor service, and it was a bit confusing. So getting that model originally was always quite difficult at the early days. So again, this is a shot with obviously the old Sikorsky, and so I suppose first and foremost, just to give you an idea of our model and our vision that has evolved in the last 8 years, that has brought us today. So pre-hospital emergency medicine, I suppose, there's no speciality bar the mainstream ambulance service personnel in that area. So this is a shot from Basics in the UK back in the late 60s and 70s. A doctor, a GP, general practitioner, with all the extra equipment and the blue light and his safety jacket and stuff like that. So there has been always a history of pre-hospital care within the community. For many, many years, the GPs have been doing an element of it, going back many, many years ago. And in the UK, this model with Basics, in fairness, Douglas would be very familiar with it, one of the co-founders of this originally, is that basically what they do is they use volunteer doctors or people in advanced life critical care that they give their time to the community. So basically, it's supported by a charity that fundraises to make it cost neutral a lot of the time for these doctors. So our vision, our mission, I suppose, look, in a nutshell, we want to get this into every county within Ireland by 2017. We have a massive commitment from general practitioners and specialists, and also we're in discussions with the National Ambulance Service in relation to advanced paramedics responding within their community at their clinical level, not as community first responders, but as at a higher level. And that's something, down the road, I'd like to see that happening within that space. So just to forewarn you, some of these slides, if you're squeamish, aren't. I put a few of them in there of some of the stuff in the QA mightn't be very nice. So again, the challenge, look, we know within the rural community, the biggest thing, you can't have cover in every corner. And I suppose we have a rural population, we all know that. Emergency services can be challenged at different times due to the graphics spread of the country. In fairness, like West Galway, West Mayo, you name it, our own part of West Cork, Kerry, there's lots of parts of the country, even within the Midlands, can be challenging at different times. So what we're trying to do is get as much the highest level possible within the clinical spectrum. So it's high in clinical care in that space. So our short-term model basically is to engage with all the doctors within the area. And I suppose the one thing we've been very, very lucky is within our journey in this, do you know what I mean? First of all, we had Dr. Jason when we started out in West Cork. We had also Dr. Carol Knappman come on to help him, and also the development of this moved on to East Cork. But East Cork, Dr. Udorn has been doing this for many, many years, and his father before him, I suppose historically, a lot of the model would be based upon their great work that they did and that they continue to do. So the one thing is to get these doctors to operate and to get the community behind them to fund it. But the biggest thing is the clinical governance, and we were very lucky for Professor Stephen Cusick out of CUH to go along and look after that element of this thing, especially in partnership with the National Ambulance Service. And I suppose how are we called? The question is we're called basically through the 999 system, and when people ask when are we available, it depends on the doctor totally, entirely. Some people give a little bit of time, some people give a lot of time, and there's no set times, it's when they're available. So it's not a dedicated service, you know what I mean? It's a service when it's available, it's great. So that's just a little oversight. And a lot of interesting stats is that in a good percentage of our calls that we are able to stand down ambulances. And that was an interesting fact. I have the figures and stats around that. And basically, where I come from, if an ambulance is taken off scene for whatever, an instant emergency, it could be 3 to 4 hours before that's back in our area again. So to free up an ambulance, a resource within it is a great thing, you know, within that space. And also, I suppose we quantify things as interventions and lives saved, which it'll be a big factor, but it's not always about that. And an interesting number of cases has been when organs extraction, we've helped with the organ extraction in a few cases, and that's always so someone else get the benefit of a life, do you know what I mean, within that space. So again, where we fit in the thing, we're not a standalone service. We're there to complement the existing emergency services. We are there as a complementary and add on to it. And so it fits lovely. In fairness, there's a great reputation within that space between the fire service and the ambulance service and the Gardaí that we have developed over the time. So please excuse me, this is a couple of shots taken from our colleagues in the College of through Edinburgh. So I'll slip on from that. So look, again, we're maximising the existing sources. I suppose one of the biggest thing is that the role of the doctor. All right, they go out in the middle of the night and they do their really, really great service. And a lot of the time they're faced with a scenario. You know, when you train, most doctors are used to a straightforward environment within either they're a GP, emergency department specialist, or an anaesthetist. They work in a fairly well structured environment. But when you go out into the remote areas, into a farmyard at night, at a roadside crash, do you know what I mean? the whole thing changes, you know what I mean? It conditions, cold, you know what I mean, screaming, you know what I mean? And it's confusion that comes into it in a lot of ways. So training is a very, very key factor within that space, you know what I mean? And where you fit, and also training with the mainstream services, which is so important within that space. And I take my hat off to any doctor, because it's the role that they do is absolutely immense. And where does us as volunteers come in to support them? In a couple of ways. Obviously, we fundraise, which is a big part of what we do. We make it cost neutral and make it easier for them to do what they do best. You know what I mean? Secondly, I suppose in a couple of instances, doctors have, because they mightn't have got to the scene first, and the ambulance arrived there and picked up the patient, but they still needed advanced life support. Is that what the doctor a lot of the time would do? Would abandon the vehicle and jump in the ambulance with the equipment. And what we do is we pick up the vehicle and go up to the Centre of Excellence and pick them up. And a lot of the time, other instances I know for a fact of volunteers have gone out and collected their children from school because they weren't able to be there, because they went out and responded for their community. So the community dedication that they give is absolutely immense, do you know what I mean? So where do we want to be? We want to be in every county in Ireland by 2017. There's no short vision. So I have a little one down the bottom with the helicopter in there. I suppose we cannot go away from our original vision, do you know what I mean? It's still a big wish. And so I suppose, what do we need to do in order to become a rapid response? We need to get commitment from a general practitioner, a doctor, or hopefully an AP in the future at that level. And basically what we'd like to do is bring them along, and in our partnership with our colleagues in University College Dublin, and I must take my hat off to Professor Ger Brewery and Mairead and their team in the EMS. They have been absolutely tremendous. So our partnership with the EMS and the merit programme going forward is immense. So we are hoping to see lots more doctors on the ground out there. Now, the thing is, the doctors can be at different levels. You're not going to go out and do all this singing, all dancing that Jason does in West Cork. Some doctors will just go out and do a little bit, and that's okay. There's no set time. You do as whatever you can when you can, and that's important. And the resources, as I said earlier, that it's there for us to bring those resources to you. So as a community. So these are two stories I normally tell. There's hundreds of stories of successes between West and East Cork over the years. But one thing we really forget is it's all great, the good stories, and in this one, unfortunately, the father backed over his son, and the other one was this young girl spilled a chip pan on top of her 18-month-old brother. And, the outcome was very, very good in both cases, because in early intervention, like Cathal said earlier. But the one thing I have met the doctor many times, and when they've come back, and when it hasn't been successful. And I think we have to remember that. And I think, look, as community first responders, you'll all have came to that in this case. It's great to get a success, but in a lot of cases, Cathal stats as well says the same. We don't always get there. And I can remember one instance is this particular doctor, and I'm not going to mention where, he came back, and it was with a 2-year-old, and him being a young father as well, and the outcome wasn't great. The 2-year-old passed away, and this doctor spent hours and hours and hours. This is late at night now, and this person had to be up for the shift in the morning at 6 a.m. and he hadn't seen his family. So the commitment, and he had to go home, face his family, get up next morning, shake it off, and go out to work again and face this. And within 2 days, he had a success. But the commitment that these people give, you just can't. It's absolutely amazing. And so everyone plays their part in the chain link in order to get there. So ICRR's role is to support as many doctors within the country and get that model there. Okay, finally, I just want to wrap up. And we can't have hospitals in every corner, and we can't have ambulances in every corner. But I think it's thrown at us a couple of times is that it's up to the state, why isn't the state doing it, and so forth. It's not about that. I think as CFRs, as off-duty emergency service personnel, doctors and so forth, we do this not for anyone else, it's for our community, and that's what it's all about. Thank you for your time.